Hi, everyone, and welcome back to the Social Work Bubble podcast. I'm your host, Laura. I'm a licensed master social worker here in New York City. And today we welcome a special guest, Eyesha Shaikh, who will be speaking on working with vulnerable populations and their social determinants of health, specifically how many different factors kind of come together to really contribute to health outcomes for vulnerable people. So a really interesting, really important conversation that we'll be having. But before we get into today's episode, don't forget to like, share, and follow the podcast on whatever platform you're listening on. Now let's get started. Thank you so much for joining us today, Eyesha. As we get started, can you introduce yourself to the listeners, including your background and what you're currently doing?
Yes, of course. Thank you so much. And I'm really excited to be here today. So I currently reside in Northern Virginia, here in the D.C metropolitan area. And I'm in my final year of my master's program at George Mason University. I recently finished my first placement at the Mason and Partners Clinic. So I actually worked with a lot of the vulnerable population along with immigrants, working with different types of social determinants of health, which is basically all the kind of factors that we look into when considering a person's demographics and, their background pretty much. And currently I'll be going into my final year of my master's program, doing my placement at the D.C Children's Hospital here in D.C., working with the cystic fibrosis unit of the ICU, kind of coming up with treatment plans and working with families and children on their medical diagnosis.
Exciting. Okay. So there's a lot of awesome experience that you have that you'll be getting into, and you're an MSW student right now, right?
Yes.
Okay. And when are you done?
May 2024.
Oh, exciting. Okay. Well, that's great. Now, in kind of starting this conversation, when we're talking about vulnerable populations, what do you include in that based on your experience?
So based off my prior experience, we actually, include the vulnerable population in a wide variety of settings and different demographics. So we kind of consider the vulnerable, many people think of it like less fortunate, but when we look at the population, it's not just those who are less fortunate, but those who could be classified as immigrants, those with ethnic and different cultural backgrounds, including Hispanic and Latinos, South Asian, African Americans, everyone that pretty much comes from a background is considered to be in a vulnerable population. And then specifically those who don't have as many resources or don't have access to many resources that we do here are also categorized in the vulnerable population.
Okay, right. So in many ways, it's kind of groups of people that we typically know are oppressed in some way or marginalized in some way.
Yes, of course.
Okay, perfect. Now, when we're talking about social determinants, if I'm saying that correctly, what's included in that?
So some of the factors and determinants that we look at when conducting the social determinants of health can be as something as small as food insecurity, housing, employment opportunities, education, social status, legal status, immigration, transportation. And it's pretty much all the resources that we would have access to, but these individuals, part of the vulnerable population, have a harder time having accessibility, availability, affordability towards these resources. So to give you just a small example of this, it would be kind of like, the food banks that we have, they serve a lot of the vulnerable population because, they don't have the means to be able to afford the food that they're looking for. Or someone who comes from overseas is looking for housing, but they may not be here legally. They're considered to be vulnerable and they need housing assistance, in which sometimes it is tougher for them to get that assistance giving, their legal status, and they don't have a source of income that is through a W-2 or an I-9. It's more so they're just doing cash opportunities to make ends meet here. So those all factors taken into consideration kind of make up who we are, right now. But when we look at the demographics, we see that there is a large gap in many of the resources that they don't have.
Certainly. It kind of reminds me of in social work, just like that systems theory where we're looking at all these different systems that people are a part of and kind of what resources they need, what ones they already have, what ones they're lacking. So, it's very important. Wonderful. When we're talking about vulnerable communities, how are they affected by these different social factors you're describing?
Yeah. So kind of going back to, the social determinants of health assessment. So we conduct those to see where these gaps might be lying. So they're affected by things because of a variety of factors, and it could be their social status, one of the biggest ones. A lot of the population I've worked with has come overseas, but they are not here legally. So they have a lot of food insecurity, meaning they don't have the means to be able to afford the food that we have here at the cost that we sell things here. And given that they don't have the means, they obviously cannot work a job because they don't have that status here. And when they don't have status here, they can't work, they don't have food, and they can't put a house under their name. So affordability becomes very tight for them. Budgeting gets tight. And so the reason why, we have all these food banks is to serve these populations, but there's not enough programs out there to be able to support the other factors. Transportation, does rely you to put you do need to put some sort of monetary value into public transport to be able to get around. But again, those things are tight for them. And so it affects these vulnerable populations in ways that we may not understand during, today's time as we are working with individuals, or if we have, employment opportunities here that are more available to us, but they have a little bit more, I want to say, barriers that prevent them from being able to accomplish the same goals that we might have.
Mm-hmm. Definitely like a snowball, it sounds like, where someone's trying to make headway to better their life and to do what they got to do, but then there's all these different things that kind of are barriers against them achieving those things.
Oh, yes, for sure. And they're very limited to their opportunities given that. So it's a snowball effect in just the small circle that they do have to work with. So there's things where if they can't get out of this loophole of not having enough money, then they can't get out of the loophole of not being able to afford rent or mortgage, and also not be able to obtain as many food resources as they need for their families.
Okay. Now this is, you mentioned like a survey. Is this something that you do when you first start working with clients?
Yeah, so one of the two assessments, so we do two when we first start working with clients. So we do the social of health, which is again looking at all those determinants and factors that affect an individual and how they are impacted. And then the second, the PHQ-9 depression scale. So we work with both and sometimes I do have a positive correlation in terms of a person might be suffering from, a past experience that's also affected them from having any sort of motivation towards working or, obtaining a lifestyle that they would want to achieve here. But again, like if they have those, factors all playing into it, it does go hand in hand sometimes that also plays into effect. And social determinants of health looks at a wide variety of things. So the assessment that we would conduct would be a little bit more minimal, but again, the follow-up questions that we would ask them would kind of tie in those other factors as well.
Definitely. Such a big part of social work is like making sure clients have resources to meet their needs. And so I'm seeing even this intersectional approach of, okay, let's kind of see what's going on. Let's get this big picture, and then we can kind of go from there to see how we can help this client move forward. Oh, great. Okay. Why is it, from your perspective, why is it important that social workers understand the social determinants of health?
Yeah, I think it's very important for us to understand the assessment first because, we do a lot of advocacy work. We're out here to help our clients and advocate for them. And this is one of the big things that do affect their everyday life. While we are supporting them in emotional and mental health, but there are other things that they do need. And so a lot of their mental or physical or emotional health can be stemming from the things that they are trying to achieve but cannot achieve. And that in itself takes another toll. So, at the level of work that we do for advocating for these clients, it's not just to support them in those aspects, but also to help them with achieving their daily life goals that they want to have. They're people just like us. And so we have to find that, the resources that we have, sometimes we may take those things for granted because, we're kind of expected to have breakfast, lunch, and dinner. But these people are just they're going out every single day just to be able to make that one meal's worth of money through, cleaning a bathroom or cleaning a house or construction or something cash related so that they can make that ends meet for their family. So it's important that we learn the advocacy skills to be able to provide to our clients, to make that difference in their everyday life. And it truly is a rewarding experience based off of my experience itself working at the clinic, being able clients come back after a couple months for like a follow-up appointment because it is a medical clinic, but then also hear that, hey, I got a job here, or, I'm able to babysit for this family, or I have been able to go to the food bank and I was able to get some resources. And so being able to provide that to them just felt very, very rewarding to me, but also understanding that they're so grateful for the effort that we put in to help them.
Absolutely. Because it's also very tangible work, to advocate in that way, to get them resources. I think it's really encouraging because we can actually see someone progress and move forward versus a lot of like internal work, like me as a therapist, a lot of progress is like, oh, okay, like they got better with their feelings, which is still awesome. But to be able to see someone tangibly move forward or get more support is really exciting.
Yeah, for sure.
Wonderful. Now, when we're talking about health outcomes, what are those specific, like the impact of health that you've seen on these vulnerable populations?
Yeah, so looking at the overarching health of these individuals, a lot of them have come in because they had underlying conditions that they did not know they had.
Wow.
So healthcare systems here have proven to be significantly more advanced than some of the third world countries. And so
Mhm.
looking from that point of view, coming into the clinic and their, blood pressure or their blood sugar levels are super high, but they didn't know they had these problems. And so to come after 50 years of their life to this new country and being able to have treatment, or like getting a mammogram or getting some sort of like scans done to make sure everything's okay, or just being able to talk to someone at the clinic and then finding out they've been through a traumatic experience, they've had suicide
Mhm.
ideation, stuff like that, and then being able to see how that impacts them this far into their age. So not getting treatment for all those years and then now starting treatment, it's a huge setback for them, but then also poses higher risk for other sort of diseases to develop, especially cardio or cardiovascular or, comorbid diseases. And so it's really
Mhm.
scary to think that all these years they didn't know they had something, and now that they're trying to get treatment, yes, it's a starting point, but at the same time, when you come that many years without treatment, it's kind of hard
Mhm.
to bring you back to baseline, because you got to start slow. Our human
Mhm.
bodies are fragile in that aspect. And so we can't just put you on the highest dosage of some sort of medication to be able
Mhm.
to help you, but we got to start somewhere. And so just seeing how their current health affects their long-term health, or how many problems of a younger individual health, health problems an individual at such a young age can have because they didn't know,
Mhm.
because they don't have the resources or technology. It was really hard to see,
Mhm.
especially when it came down to like cancer or things that were like, life threatening. So
Right. Absolutely. I mean, in some ways, it's so exciting that people are getting the treatment that they need now, but then when there's been so many years of not having that, it's we're not going to be good. We're going to notice some of those like negative consequences of not having that care. Oh,
yeah,
wow.
for sure. And
Well,
there's a gap in that advancement of medicine in other
mhm,
countries versus here. And the nice thing about the clinic was that, because it was a free clinic, they didn't
mhm,
hesitate to come in to the clinic to be treated or to be seen for stuff. And
good.
because there was no monetary value associated with that, it kind of enticed them more to kind of get treated. Otherwise, I feel like there's a lot of times people have backed out from getting treated or getting, even with
Mhm,
job right now, we don't see many people that want to be treated because of, the affordability aspect of it. When things are
mhm,
so high price here, people are going to be like, well, I'd rather suffer than have to pay that because I don't have that kind of money. I'd rather live
mhm,
an extra day than, just to get treated here. And so it's tough to see that because it's an internal battle that they have to face and experience on their own. But,
mhm.
to advocate and be there for them has definitely been a great help. And I've seen a great difference in many of the clients I've worked with.
Absolutely. It really emphasizes the importance of those community programs that meet people where they're at, because even like right now, like I have insurance and there's times where it's like, okay, this thing is still massively expensive just for like a regular checkup, even having insurance. So to meet people where they're at and kind of just offer these free resources, free care, I mean, it's huge because that takes down one of the barriers to them moving forward and having a life that feels good for them.
Yeah. And it's definitely like when we see clients come in for an initial visit and then a follow up and I can see improvement, that shows that, it's a eye-opening experience for them to come and be like, wow, I have something and I want to get better because here are the consequences if I don't, and here are the risks that come with it. So it's really nice to see them come back and then, be in a lot better shape than they were when they first came in.
Absolutely. It reminds me too of just like Maslow's hierarchy of need, like when we're able to almost like check those boxes, like, okay, we're getting physical health under wraps, making sure that's good. Like we're able to move up and continue to like thrive in life, which is great.
Yeah,
Okay.
yeah, for sure. And it definitely is a hierarchy when you see them start so low and working their way up.
Mm,
It definitely makes sense.
right. Do you notice any specific like mental health impacts or outcomes, any patterns there with the people you work with?
Yeah, so the people that I've worked with in the past, specifically at that clinic,
Hmm.
find that they have maybe a food insecurity and they need employment opportunities. But aside from that, hearing what brought them here and why they're here, and then their backstory starts to come out from back home. And I've seen a lot
Right.
of individuals from like PTSD and trauma, and it's like, well, what brought you here? And it's like you've heard that they've had to flee because of, like a related issue back home, or like, they had an abusive situation with a family member, or they were sexually assaulted, or they had something really traumatizing happen to them back home. And it's like, that's when, you know, it makes them emotional, and that you may
Mm-hmm.
need to be there for help. And the counseling sessions that we did offer our students were free for the individuals. So we would schedule like 30 minutes to an hour, however many sessions they needed every week, bi-weekly, whatever it was. And we would try to be there to, counsel them and kind of give them, whatever techniques that we were educated on. So whether it was meditation techniques, journaling, anxiety techniques, breathing exercises, stuff like that, just to be able to help them, and then, perform a counseling session that would be about 30 minutes to an hour, based off of their needs. So it was really nice. And then they had access to our phones,
Mm-hmm.
not 24/7, I would say, but we were available for the most part, whenever they did need it. Our hours were until like 4 or 5 p.m., but we would be available outside of those hours as well.
Sure. Yeah. I mean, I'm loving this approach too of kind of tackling both medical and mental health, at the same time, because so much of that is intertwined, where there's like mental health things that show up because of our physical health or vice versa. So to be able to treat someone physically, but then also offer that like mental health support and counseling and those social work resources is just like, I mean, so huge. That's great.
Yeah, and a lot of the times we did do the depression PHQ-9 scale assessment. It was oftentimes where, they answer the questions that I feel hopeless, or I often feel tired, or I feel sad a lot. All those questions that we would ask them through the assessment, we would find that eventually when we would ask them when did it start, and it would be around the time that they're not feeling the best based off of the symptoms that they're here for. So a lot
Mm-hmm.
of the able to clear their depression scale based off of medical reasons for why they were here, more so
Mm-hmm.
than having a history of depression or suicide. And so when we noticed that some of them were high, we would ask them deeper questions to follow up on these things, and found that it was medically related over actually a mental health related issue. And then other times it was obviously mental health related, and that's when we were able to like dig to the bottom of things, and the story did come out, and we would be able to ask them follow-up questions and get them the resources, whether it was a domestic violence
Mm-hmm.
shelter, call if they were suicidal, we would call for them, or we would check up on them regularly. So it was nice to see that, you know, sometimes individuals may not understand the depression scale as much.
Mm-hmm.
Um, that answer, we were able to ask those questions to see, what might be the root cause.
Sure, absolutely. I mean, these different vulnerable people that you worked with, was there a resistance if they needed a higher level of care, they were experiencing some really intense suicidal thoughts, or there was like a safety risk? What was that like?
Yeah, so sometimes it was really hard to ensure that a client after leaving the clinic would
Mhm.
actually go get seen for longer term health,
Yeah.
or so, sometimes if we really felt like an individual was, on a high risk of suicide, we would call 911 for them. But
Hmm.
other times, if someone, was, I don't know, suffering from like cancer or something, and we wanted them to go get a mammogram, we actually had connections to Innova Cares Clinic, which is a free clinic through Innova,
Oh,
which is
great.
and a medical facility. So we would actually refer them and put in referrals for them, and then they would be able to make an appointment to get those at either no cost or low cost
Hmm.
services. I don't want these clients to be held back just because something
Hmm.
costs their money. And so we wanted to ensure that their care was, they were insured care pretty much. And
Hmm.
so we did our responsibility. And then if they were to come back from the clinic, we would request those records from Innova and see if that we can go ahead and get them back onto track if they were here, not within the time frame that they were supposed to come, or just see what's going on pretty much. Almost like a primary care was,
Hmm.
we were doing. And if someone was really at a risk for that suicide, we would go ahead and obviously call for 911. But sometimes it was really scary to like give an individual a referral for like a heart, like an EKG or something that was out of our scope of practice, and not know
Hmm.
if they were, because we obviously don't have any control over the client after they leave the clinic.
Right.
And so there's, um, And, I did have a couple scares when it came to that kind of stuff. And I just wanted to make sure my client was okay because I would never know. So I've had to touch base with them after a couple of days knowing that they complied with our
Mm-hmm.
recommendation. Really nice to see that they were able to get the help, and the hospitals do have financial assistance programs. So they were able to get, a big lump sum of the money that they were supposed to owe covered by the
Mm-hmm.
hospital. That was good that they had good news because a lot of them hesitated going to a hospital given the costs affiliated with their services, especially surgeries.
Right.
So yeah.
Oh, wow. Well, I mean, it sounds like a lot of your work too is like helping reduce those barriers so people are actually willing and able and capable of following through on these different recommendations. Because it would be very different if like that financial aspect was at play. And because I mean, that's going to be a huge barrier for most people.
Yeah, and that was our goal, was to reduce these barriers so that individuals were able to overcome the obstacles that they had. And then the other thing we wanted to look at was how we can remove these barriers but lead them towards an independent lifestyle. So we didn't want clients to think that we were going to be there just to do the work for them.
Right.
And we would provide them the resources and the information that we had as students to be able to give to them, but not do the work necessarily for them. So if
Mm-hmm.
they schedule like an appointment at Inova to go get a CT scan or an X-ray or something, we would give them the information, the address, the phone number and stuff, and we would follow up with the individual to ask, hey, were you able to get an appointment? But we wouldn't like call Inova for them because we
Mm-hmm.
wanted to get a level of independence as well, because we want people to lead their lives. And so if we did things for them, it would be a process that they would never learn on their own. And that was our goal, to remove these barriers, but also let them live independently.
Right. I imagine that's more empowering for the client too, because I mean, especially with people that are coming when maybe they never really had this kind of care before or health care before, it's overwhelming. So it might take time to actually get used to it and be like, oh, okay, like I have to reach out to these people. So to kind of give them that control and that independence there, I think is really helpful in people actually doing what they need to do and following through.
Yeah, I think the only thing that I really saw individuals kind of fear during this process was their legal status getting in the way
Mm,
of. A lot of them wanted to ask, will this affect my visa? Will it affect my green card? Or will it affect whatever social status they had at the time, or
mhm,
like their immigrant stuff? Because they were worried that if they did get care, that if this is impacted, they'd rather not. So just to be able to like have that validation was good for the client, because they were able to understand that no, that part of it is separate than their care, and then they were able to comply with our medical advice, which was comforting for them, but also comforting for us to know that we did our job and this is what the client is able to
mhm.
do now.
Absolutely. It's exciting. Kind of rewards for both the client and the social workers.
Yes.
Good. Now, with social workers, how can we take all this information about vulnerable populations, those social determinants, and apply it to how they practice and work with their clients?
Yeah, so I think basically based off the experience that I've had, I think it's important that we take our skills that we learned, throughout our programs, but also
Hmm.
like what clients that we're working with and the skills that we've learned and the things that we've discovered and how we can learn to put these skills into an advocacy way. I
Hmm.
think a lot of the work that social workers do is to advocate, and that can be as small as advocating for, an individual or a community or a large set of individuals. But again, we use these skills to not only provide mental and emotional help, but we got to use these skills to advocate in other aspects. Again, going back to the social determinants of health,
Hmm.
they're not impacted mentally and physically, but more so just their lifestyle, everyday living functions and stuff is so important to them that they can't be emotionally and mentally supported if they're not right here. So
Hmm.
I think just being able to give them this opportunity has shown how grateful they have been for the tough times that they've experienced. And now that they're able to get the help, they're able to see the great impact that they have on their lifestyle coming from their home countries to the US.
Yeah, absolutely. I mean, it helps social workers to, I think, see clients more wholly, when we're able to understand all these different parts of who they are and what they're coming from, we're able to do our job better and actually meet them and advocate for the things that make sense. And I mean, advocacy is such a social work thing. It's, I think one of the things that really distinguishes our profession is being able to actually like do that boots on the ground work and help clients get to that next step.
Yeah. Yeah.
Wonderful. Okay. Now, I mean, can you give some examples of how you've specifically advocated for clients, like from your experiences?
Yeah, so I've advocated in different ways. So some of the
Hmm.
advocacy that's, happened has been able to like call around, hospitals to find out if there's financial assistance programs. I actually did a project with Fairfax County, which is one of our bigger counties here in Virginia, working with different food resources. So I worked with food organizations to see if there would be a larger organization, like a nonprofit organization, that'd be willing to donate a big bulk of food to our clinic, because oftentimes we had those that were experiencing food insecurity.
Hmm.
So we provide them with the food box before going home. And so my goal in that project was to work with, and network with different organizations to see if they would be willing to give us a donation so that we can provide non-perishable items to our individuals, within the budget that we had set at the clinic. So calling the food banks and emailing them and getting a hold of them. And then I actually did a presentation amongst a bunch of different food organizations from Fairfax County to
Hmm.
advocate what my goal was and to see if anyone would want to be a partnership with us. And
Wow.
so that folks, I was able to find a couple. And then, before my placement was over, someone else had taken over from the clinic to be able to see what the next steps would be based off the two organizations I was able to find to be able to help us. And, hopefully they were able to get a partnership with them. But, I was able to present at this mass meeting. There was like 15, 20 different organizations that had joined,
Wow.
and being able to kind of present on behalf of the whole clinic, because we had 3 different clinics,
Mhm.
was really cool. They saw what we were looking for. They had the same goals, but, some of them were willing to help us, either at a cheap cost, but, again, if it wasn't in our budget, we would just try to resort to the ones that were able to help us. And it was
Right.
really that, I was able to advocate for our clients, because food insecurity was one of our biggest, barriers, where someone was able to, get food from the local market, but it was too expensive, to someone who was just going once a week because the food bank near their home isn't open. Because again, transportation was a barrier as well. So some of the
Right.
food were open only twice a month. So just giving them options, and then seeing if they wanted to come back to the clinic just to get food, they were able to, if we had a large donation come back to us. So,
Wow.
that huge advocacy project was really an eye-opening experience to see, like, wow, it is really hard to find food resources at such a cheap or no cost. And
Hmm.
I look at inflation and look at things now, and I'm like, things are so expensive now. And it's like, we don't think twice about
Crazy.
to, Chick-fil-A or, excuse me, like McDonald's, and buying like a meal for $10, but that $10 goes a long way for some individuals. And with the inflation rate, it made it even tougher for these individuals to afford things at a cost. So that was one of my biggest projects. But then being able to just help, financially,
Yeah.
figure programs, provide them the resources, the forms, validate them that they're going to get the help that they need at a discounted rate. It's 0% of their assets, whatever it was. It was
Hmm.
really.
Yeah. I mean, amazing work that you did, and shows too, like advocacy can look so different at many different levels. And I mean, that can look like advocating for that collaboration among agencies, like supporting each other. Because ultimately, I've seen in some communities, agencies can feel very individual and kind of separate from each other. But if we kind of, again, like kind of come together and support clients, I mean, it'll create massive change. So that's great.
Yeah. Yeah.
Wow. Now, from your perspective, this is kind of a big question, but how can social workers take action to see these social determinants change, since they do impact clients so much?
Yeah, so I think we need to understand that, like, a lot of these individuals come from underlying, experiences. And so I think that was
Mhm.
one of the things that I saw, was that a lot of the reason why people have come here, or that they were here, or we have unfortunate individuals, um, is because of those things, and they've come here for a better lifestyle.
Mm.
Now, US is so different from where they've come from, where everything costs money, and, a lot of things are more expensive. And so looking at these things, they were compromised of so many resources that they may have had back home, like housing. They didn't
Mhm.
have as much, or they did have jobs there, or they didn't have food insecurity because things were cheaper back home, or they just had more resources that they don't have here. And so being able to advocate for, I think, bigger organizations to make more resources available, having, more opportunities for jobs, that are not just cash jobs, but giving these individuals an opportunity, because I think a lot of the things that people focused on was legal status. And I think to me, that was the biggest barrier. And I don't think that should be one, because just because someone's come here without any status here could be for a really hard reason. I did have experiences where I've had individual come here because of a traumatizing experience and they had no choice but to leave. And so to just stop from obtaining employment here, or to have a house, or to be able to afford food, or to be able to have transportation was just heartbreaking to see, because they're coming here for a better lifestyle. They're coming here for their own safety, yet we're posing more barriers as they come here. And not just one barrier or two barriers, but many more than they had when they were back home. So it was a heartbreaking experience to see these clients suffer, and then suffer even more when they came here. And so part of the change that I feel like we can make as social workers, and the action we can take, is to continue the advocacy work that we do, but also push for and organizations to offer more resources that are not available right now, and to have more funding, or to have more government involvement to push for these things. Not everything I feel like has to have a monetary value to it, or we should have more drives and more food banks and stuff like that to make those resources available.
Absolutely. Especially when I think we live in a time when I think politically a lot of social programs are risking like being cut, or not being like given the financial like backing that they really need. This really shows the importance of the work that social workers do to advocate on all levels, whether it's that one-on-one support for a client, or that bigger level to, okay, we need policy, we need funding, we need kind of communities to really come together, can just, snowball into such a huge positive impact.
Yeah, and I think that's what we need, is more people to be aware of the issue, to be able to push for it. The more people that we have advocating, the more I feel organizations and individuals will start to realize what a big issue this is, and maybe things will change, and maybe things will get better, and we'll have more resources to offer.
Absolutely. Now, we touched on a lot of really awesome stuff today. Out of everything that we discussed, what's one thing you feel is really important for listeners to take with them?
Yeah, so I think one thing that we need to really focus on and take away from the things that we've learned is that the vulnerable population are at a great disadvantage. And whether that's proven through the social determinants of health assessment, whether that's determined by their emotional and physical health, there are just so many more barriers that I feel they experience over an average individual that has all the resources. So as social workers, I think we need to understand some of the biggest barriers they and to be able to help and advocate for those tough times, and kind of push for a foundation so that they can work up on their own. And that might take a little bit of time, but I think, as social workers together, we can work on this huge advocacy project and push for it through policy, through advocacy, through, different organizations, clubs, whatever it is, to be able to push for.
Absolutely. Because I think that's something that can get really lost, is we can get sucked up into our work so much where we forget, okay, let's advocate for change. Let's change these systems that we're working in. Let's get more resources, because that'll also help our job be more manageable when we're able to see that change happen.
Yes. And I think that's what, when people hear social work, they automatically resort to therapy, and they resort to health and abuse and neglect, and these big that are so grand, yet the underlying issues, or the basic necessities, or the limitations and the barriers that these people experience, are often overlooked, because there are so many cases out there of mental health and emotional health and physical health and abuse and different things that top those things. And it's well, maybe the abuse or the neglect is stemming from a social determinant of health, of maybe food insecurity. The child is neglected because the mom has to work all the time to be able to make ends meet. So it's the overarching issues all have these little things underneath them. And I think we look at the bigger picture, but there's so much more that goes into it. So I think the overarching goal of advocacy should be looking at all these different things in a wider scope, but then also seeing the little factors that play into why these issues might be happening. And that's where I think further investigation has to go in, so that we can figure out the root problems. And then once those things, we have to work our way up and not our way down.
Absolutely. That's so important. I'm feeling so energized to advocate right now. This has been so great. Now, as listeners want to follow you, where can they follow your journey and kind of keep up with what you're doing on social work?
So I do have a lot of experiences and things that I do, through school, whether that's through organizations, and I try to join like a lot of different organizations and clubs. And so personally, I don't have like, a platform itself, but, as a social worker, in the next year or so, I do plan on having like my own page and stuff. And I have a few family members as inspiration because one of my aunts actually is a doctor, a DO doctor. Has her own like TikTok pages. She has her own Instagram and all these different platforms that she uses to kind of advocate for the individuals that she's trying to help. And then the social work end of things, I definitely do use my Instagram a lot of the times to, again, repost the things that she posts on there, but then also that I see, that people can benefit from. And I feel like those things I've had people, comment on them, make little comments or kind of relate to it. So it's really nice that I use my personal photography page for that reason, but then also I do plan on having my own as well.
Oh, that's great. Okay. So people can follow you there, which will be linked in the description. And then in the future, I mean, you'll be graduating next year, which is exciting, and kind of continuing on your journey. Wonderful. Well, thank you so much, everyone, for listening. Thank you, Eyesha, for coming on the podcast today. I think it was a really helpful conversation. For the listeners, if anything resonated with you, please like, comment, and share, and we will see you next time.